So my final introduction for the day is, I don't get to introduce my whole home group at the department because Wendy, who was here this morning, was already introduced and already left. But Wendy is also part of our group. But the final person for me to introduce is Professor Glantz, who is and has been a member of my department before I even came into the department at the School of Public Health, and also is a professor at the School of Medicine and the School of Law. And he has graciously agreed to offer some commentary on somewhat divergent topics this afternoon, and then we'll open it up for further discussion. So with no further ado, Leonard.
I don't have slides, I just have charm, which is what I'll use to keep you interesting, yes. I'm going to talk about the suicide part of this afternoon's discussion and not the PTSD part. And I'm interested in suicide, not personally, but academically I'm interested in suicide because I teach mental health law, and mental health law has a lot to do with prediction. Right, that you try to predict who has suicide, you try to predict who's going to be homicidal, because then you could take important actions, right? And mostly my sense of it, from reading that literature and looking at it for like a long time, is that you can't do it, that it's essentially impossible to do it. And I want to suggest that that's also true of suicide. So we could, so the question really is, what is suicide prevention, and how serious is suicide as a problem? And is it a different problem in the Army than among civilians, right? Because it's not like only people in the Army kill themselves. The interesting thing about the rate of suicide in the Army, which just got higher than the civilian rate, the rate of suicide in the Army is 20.2 per 100,000. The rate of civilian suicide is 19.2 per 100,000. That's not really a big difference. And you wonder why, at least when I read the stuff, I wonder why the rate of suicide in the Army isn't higher. That there were all kinds of reasons to believe that the rate would be higher. So for example, exposure to weapons in the civilian population. There's a very, very strong correlation between having access to handguns and firearms and suicide. It's not that the exposure to handguns and weapons makes people more likely to try to commit suicide. They're just more effective when they do it. Now, handguns, firearms are used to commit suicide in the Army more than in the general population. Obviously, the access has some effect. But when we talk about there being, an epidemic of suicide in the Army, there's actually no evidence of that. It looks just like the rate of suicide, pretty much, among the civilian population. So when one reads the report that George just talked about, the question that's never raised is, what would the rate have to be for a suicide prevention program to be successful? Right? So what if it was 15 out of every 100,000? Would we be fine with that now? If the rate hadn't exceeded the civilian population, would anyone have paid any attention to it at all? Is that an important marker? So that's sort of one question that suicide prevention in the Army raises. By the way, the raw number is 160 people, about 160 active soldiers committed suicide in 2009. That's in an Army of almost 600,000 people. Now, one of the difficulties with studying suicide is that it's not so easy to know who committed suicide. Now, sometimes it's easy to know, like if you find somebody hanging with a note attached to them, it's often clear. Or people who shoot themselves, it's often clear. But not always. The problems with poisoning and the problems with the drug overdoses are less clear. So if you look at CDC reports, they talk about the rate of suicide, and in separate reports, they talk about the rate of drug overdoses. And the assumption is that the drug overdoses aren't suicides. but a lot of them are. You just don't know what the intent is. So if you look at the rate in the civilian population of the deaths from drug overdoses from 2000 to 2009, the rate for white men has almost doubled, even though it's not clear they committed suicide. The rate for black men has gone up 15%. The rate for Hispanic men has gone down 5%. And do we know why? The answer is no. And then the question is, how many of those should be added into the suicide grouping instead of the accidental death grouping? There also tends to be a bias, particularly with drug overdoses, to find that the person has not committed suicide because of the stigma attached to it and pain for families. So the numbers aren't that hot. There were other odd things about suicide. So living in Montana puts you more at risk of suicide than being in the Army. Okay, that the rate of suicide in the civilian population of Montana is 20.5 per 100,000. The Army rate of suicide is 20.2 per 100,000. Living in New Jersey, however, the rate is 6.9 per 100,000. So, would anyone care to give an explanation for that, except that those are the data? Is that because New Jersey is just so much more pleasant to live in than Montana? You also find high rates of suicide in rural areas. So Maine has twice the suicide rate as Massachusetts. And then there are all these theories about why people feel isolated, they're disconnected, they have access to guns, they go hunting. But those are humongous differences, right? The difference between 6.9 per 100,000 and 20.5 per 100,000. So suicide is sort of a strange phenomenon. One of the things that makes it so hard to study is that it's so rare. So when you have suicides of 120 out of a population of 600,000, it's difficult to know what makes those 120 different from that. So George showed a slide about things to look out for suicide. And one of the difficulties with this sort of thing is that there are a gigantic number of people who fit one or more of those criteria, and hardly any of them commit suicide. Right? That's the mystery of suicide, is that how do you have people who have PTSD or hypervigilance or rage or whatever, how do they go, why do some of them decide to commit suicide and others don't? And that's the hard question. It's not like, everyone who meets one or two of these criteria commits suicide. Almost no one who meets those criteria commits suicide. And then there's a small population that actually does. I think one of the hard questions about what makes the Army special is, can you train people to be warriors and expect them not to be different than the rest of the population? Are suicides in the Army different? In his book on killing, this is by Lieutenant Colonel David Grossman, who's a historian and a psychologist, he talks only once about suicide. Here's what he says about suicide. Because the book is about, by the way, what do you have to do to take a person who finds killing to be abhorrent and terrible and horrible and enable them to kill? He's not like a pacifist or anything. He asks this as a psychological question. He says, the average citizen resists engaging in aggressive and assertive activities and dreads facing the irrational aggression and hatred of others. The soldier in combat is no different. He resists the powerful obligation and coercion to engage in aggressive and assertive activities on the battlefield, and he dreads facing the irrational aggression and hostility embodied in the enemy, as any of us would. Indeed, history is full of tales of soldiers who have committed suicide or inflicted terrible wounds upon themselves to avoid combat. It isn't fear of death that motivates these men to kill themselves. Like many of their civilian counterparts who commit suicide, these men would rather die or mutilate themselves and face the aggression and hostility of a very hostile world. He doesn't describe it as depression or mental illness. He describes it as a somewhat normal reaction to a horrendous situation that people find themselves in. One question about suicide is whether suicide is a problem or a marker for a problem. It's like cholera. right? That the problem for cholera isn't that people get horrendous diarrhea. The problem for cholera is sanitation. Right? And so the diarrhea, right, the deaths that come from cholera, we can say, well, we should intervene on individuals and give them like anti-diarrheal things and give them liquids. But from a public health perspective, what you would do is build better latrines, that you would build safe water supplies. And so one of the questions that, when I read this report was, can the Army actually be an army and develop the kind of sensitivities that one would want to have in order to identify people who are at risk? So Dr. Groden talked about hypervigilance as a sign of PTSD. And I would say that if you're in a war zone, if you're in Afghanistan, and you're not hypervigilant, then you will die. That you need to be hypervigilant. That when I came here when I drove in today and I came down the side of the road and there was a garbage can on the side of the road, it never occurred to me that I could be killed, that it'll explode and kill me. When you see a dead animal on the side of the road, it doesn't occur to you that it may blow up and kill you. I mean, imagine living in a state in which hypervigilance isn't a disease, it's a solution to a problem. It's not a disease. And then to have people come back and say, well, you don't have to be hypervigilant anymore. How do you do that? I mean, how do you turn people on and off that way? So I would ask, really an essential question about, is the 160 suicides, this will sound like a really hard, really bad thing, just the price that one pays for having a prepared army? Is it essential to the culture that there be access to guns, that there be hypervigilance, that there be paranoia, that there be suspicious? How low would that number have to go before we decided that we were successful? In the report, in the suicide prevention report, there's a statement from a military official that notes, in just 6 years, soldiers experience the equivalent of a lifetime when compared to their civilian counterparts. And there's a footnote that explains this. It says, by 24 years of age, a soldier on average has moved from home, family, and friends, and has resided in 2 other states. He has traveled the world and been deployed at least once, been promoted 4 times, bought a car and wrecked it, married and had children, has had relationships and financial problems and seen death, is responsible for dozens of soldiers, maintains millions of dollars worth of equipment, and gets paid less than $40,000 a year. Well, that's not good, right? So that's not a circumstance in which people, so if you look at stress scales, like what are the great stresses in life? Like getting a new job is one, getting new responsibilities is one, moving is one, having stressful relationships is one. You put them all together with a 24-year-old. You give them guns, and you put them in situations that were described this morning by people who were in the field of combat. And the question that it raises in my mind is that why aren't more people killing themselves? All right, that all of those factors are there. So it seems to me that if one were actually going to think about this as a cholera epidemic would, that one still has to go back to the source. Is the question people like watching out for each other, to be buddies, to see whether or not they meet one of the 10 criteria, or is there some way that one changes a culture that embraces risk-taking, particularly when you're dealing with a population of risk-takers, right? That people who enter the Army are not scaredy cats, right? That they are people who are willing to confront the risks that Army life has. So the Army is a special place, and it seems to me that the number of suicides, the rate of suicides being what they are, is that something is being done that's also right. You could expect that in a culture, again, with the arms that are available, the knowledge and the risks, that one might expect more. Incidentally, The risk of suicide in the veterans population is much higher than the risk of suicide in the Army population. So the risk of suicide in the veterans population is more like 55 out of 100,000. It's more than twice as much as the risk of suicide of people in the active Army. And it's sort of not having those cohesive bonds, that closeness, that sense that I have to stay alive in order to protect my friends. When you read about how, why are soldiers so brave, that the answer is rarely because they're afraid for themselves. The answer is almost always because they have an obligation to their colleagues and their partners. That goes away, obviously, when one goes into, when one becomes a veteran. So it seems that if one were going to put money into this or effort into it, you would probably look at the veterans before you would look at the active Army folks.